tanghali po sa inyong lahat. Narito na naman po tayo. It's going to be another 1 hour of our Saturday Nutrition and Wellness webinar series brought to you by Pharmaceia Jimenez Corporation. Our today's sponsor is Neemit Antimicrobial Soap, Ultramay Glycerin Soap, at Pediatric Sulfur. Ako po, si Grace Jimenez. You can call me Grace or Dr. Grace. I'm going to be your host for this morning's webinar. This is episode 5. Ang topic po natin ngayong araw na to ay common skin disorders during quarantine. Alam naman po natin, ang skin natin ang pinakamalaking organ ng ating katawan. Napaka-importante po nito kasi ito ay capable of the sense of touch. It is also a protective covering ng ating buong katawan at tumutulong din po ito sa ating pag-maintain ng ating body temperature. Ang ating balat po, whether sa mukha or sa katawan, regardless of our color, napaka-importante po na panatilihin nating healthy at saka malinis. However, though, may mga pagkakataon po during this quarantine season or this Q time na nagkakaproblema rin po ito kahit na anong gawin nating paglilinis. Meron mga skin problems na lumalabas, whether dry skin, dull skin, or yung pangangati ng balat. Meron din pong pagkakataon na nagkakaroon din po tayo ng skin infection, either brought about by fungal, bacterial, or viral infection. Lalong-lalo na po ngayon, it has been 4 months na naka-queue tayo sa loob ng ating mga tahanan. So yung mga teenagers dyan, yung mga hindi nag-work ngayon. So titignan natin, papakinggan natin kung paano ang nangyayari sa loob ng bahay during quarantine at ano yung mga challenges natin na na-experience sa ating skin. So dahil hindi rin po tayo nakakalabas, hindi rin tayo nakakapag-exercise, hindi rin po tayo napapawisan at hindi rin po masyadong maganda yung blood circulation na dapat nagko-contribute sa isang healthy skin. So sa umaga pong ito, we are so blessed and privileged na tayo po ay sasamahan ng isang magaling na medical doctor po. She is a graduate of MCU, Manila Central University School of Medicine. Siya po ay isang diplomate ng Philippine Pediatric Society. Isa po rin siyang Rizal Awardee at Outstanding Physician for Community Service. Siya rin po ay past president ng Newborn Screening Society ng Community Pediatric Society of the Philippines at isa po siya ngayong very active consultant of Calamba Medical Center, St. John the Baptist Hospital, and Los Baños Doctors Hospital. Hindi lang po siya magaling na doktor, siya po ay a loving wife to a doctor also, Dr. Oraneem. She has 3 wonderful children who are also doctors, Dr. Enriza, Dr. Eric, and soon to be Dr. Erwin na nasa London po ngayon. So hindi ko na po papahabain at naghihintay sa kanya ang mga colleagues niya from the PPS Southern Tagalog. Walang iba po, maraming salamat po, Doktora Rowena Andres Pua. Hello, Doktora.
Hi, good morning. Good morning to all listeners, especially the PPS Southern Tagalog chapter.
Doktora, batiin daw niyo po mamaya sila Doktora Nang, Doktora Vency Manalo, Doktora Aleli Damata, nakikinig daw po at nanonood po sila sa inyo. Salamat po, Doktora. So syempre, hindi rin po naman pwedeng wala tayong guest from the consumer side. Alam naman natin na napaka-importante rin, marama natin yung mga real experience nila sa kanilang mga tahanan. At unahin na po natin, yung ating guest from the consumer side ay isang dedicated stay-at-home wife and mom to 2 children, isang 12-years-old daughter and an 11-year-old son. She is actually a registered electronic communication engineer. She is a wellness advocate and an event planner. Let's welcome Mrs. Maricel Evangelista of Quezon City. Hi, Mami Maricel.
Hello, good morning.
Thank you, Mami Maricel. Thank you for joining us this morning. Ganon din naman, syempre hindi pwedeng wala tayong wala tayong teenager in the house. So dapat kailangan marinig din natin yung side ng mga teenagers na nasa loob lang ng mga bahay nila. So We also invited a teenager who is a 17-year-old newly graduate from Ateneo Senior High School. He is actually an incoming freshman of UP Los Baños and a very, very active student at that kasi ngayon naka-enroll din siya sa MIT. So let us welcome sa ating webinar Mr. Luke Michael Cruz from San Mateo, Rizal.
No,
Hello.
good morning po. Good morning.
So handsome. Thank you sa mommy and daddy mo for allowing us to join. So ngayon, diretso na tayo dahil napapanood tayo ngayon via live Facebook sa ating mga Facebook live viewers. You can post po your comments below. Ang ating subject matter expert, our very good doctor, will try to answer some of your questions ulit. At ini-encourage po namin kayong lahat, yung mga ating FB Live viewers, to include your comments kung ano po yung topic na gusto nyong i-discuss sa susunod na episode. Plus, you can also ask us, throw in your questions, and yung pong mapipili natin na question will be lucky to win something, a gift pack from our sponsor. So, ni-encourage din po namin kayo na mag-join ng ating quick survey lang. Just say yes kung you find this relevant to you, you find it important, and no po kung hindi. So sana po, in-encourage ko, sana naman lahat po kayo mag-answer ng yes kasi we really find this, every topic talaga is applicable and very important to each and every one of us. Yung sinasabi po nating gift pack na matatanggap nyo, our very own and our very new product from Pharmaceia Jimenez, our Neemit Clean Isopropyl Alcohol. And of course, yung ating sponsor this afternoon, Neemit Antimicrobial Soap at Pediatric, our Pediatric Sulfur Soap. Pag na po napili yung comment nyo as a question ng ating resource speaker, kayo po yung mananalo. Okay, let's go on. Let's move on. Doktora Pua, uumpisahan ko na po. Pwede nyo po bang ikwento sa amin ano po ba yung mga common skin disorders at ano po ba yung pwedeng maranasan natin sa mga panahon na ganito na naka-queue tayo o yung sinasabi natin na naka-quarantine tayo at paano po kaya maiiwasan ito habang nandito po tayo lahat ngayon sa mga loob sa confines ng ating bahay.
Today we're going to have a topic about common skin disorders during quarantine. So, the skin is the largest organ of the body with the total area of about 20 square feet. It regulates body temperature, it stores water and fat, it is a sensory organ, it prevents water loss, it prevents entry of bacteria, and acts as a barrier between the organism and its environment, and helps to make vitamin D when exposed to the sun. So, this is the skin anatomy, just a simple presentation for the skin. It has the epidermis, the dermis, and the hypodermis. Before COVID-19, according to the latest WHO data published in 2018, skin disease death in the Philippines reached 1,929 or 0.32% of total deaths.
Mm-hmm.
The AIDS-adjusted death rate is 3.35 per 100,000 of population, and the Philippines ranked number 64 in the world. COVID-19 times, several skin conditions have emerged, mainly as a result of prolonged contact with personal protective equipment. This is the one we are using in the hospital now. And excessive personal hygiene.
Excessive personal hygiene.
Now, I can show you some skin conditions observed. As you can see, the pressure injury, this is due to the prolonged use of surgical mask. You can see the delineation in the face. And then contact dermatitis. This is common in children, especially when they're allergic to crayons or other toys that they are playing, and the age. Another Lesions is the pressure urticaria, acne, which is very common to all, and seborrheic dermatitis.
Seborrheic dermatitis.
The Center for Disease Control and Prevention adds 3 new symptoms.
Okay.
The latest symptoms for COVID, fever or chills, there is cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. These are the picture of all the symptoms of coronavirus.
Mm-hmm.
Okay, the same thing. Okay. Symptoms can range from mild to severe illness and appear 2 to 4 days after you are exposed to the virus. If you have the following: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, dewy sleep or face, you have to see the emergency. The WHO group symptoms in the following. The most common symptoms is fever, dry cough, and tiredness. But the less common symptoms, aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of finger or toes. So we are now
Kasama sa
cleared by
symptoms
this skin manifestation
of COVID-19.
of COVID cases. Okay. Okay. Other symptoms are this kind of of skin lesion, libido reticularis vesicular, like chickenpox lesions or
Mm.
petechial lesions. Uh, Serious symptoms is difficulty of breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Now we go to the other common skin disorders during quarantine.
Okay.
Okay. So itching. This is a sensation that extensively demands scratching, like
So,
the
okay.
infestation with parasite,
Uh,
which is due to be scabies or pediculosis. It can be insect bites, hives, atopic dermatitis, and others. Treatment is you can use moisturizing cream or lotion, but those mild one like uh, white in color and no scents, without scent.
okay. Sobrang kate.
Okay. Dry skin is common among people past middle age, but this is also common in babies and children. The
Mm.
cause of it is cold weather and frequent bathing.
Mm.
So we have to shorten the bathing time, so to
Alin?
avoid the dry skin.
Gaano ka-short yon, doktora, yung bathing time?
Not more than 10 minutes.
Not more
Because
than
if,
10 minutes.
yes, because if you prolong your bathing,
Aha.
drying of the skin is more. Then the treatment is uh, shortened bathing time, cream or ointments, and glycerin soap.
So, doktora, question lang po. Di ba tayo ngayon sinasabi you finish either the alphabet or the birthday song when you wash your hands, di ba? So, yun,
Mm-hmm.
nagkakos din ng drying of the skin yun kasi you wash
Yes,
your
yes,
hands.
yes, yes. Because now, especially for us medical people, everyone patient we wash our hands. So
Yeah,
drying up of the hands are really the problem now. But we can solve it by using lotions.
lotion.
So the next skin disease is the contact dermatitis. This can be caused by the irritant like acids, acid alkalis or solvents, and also allergic contact dermatitis, which is secondary to use of cosmetics, metals, drugs, and chemicals. The treatment is to avoid then corticosteroid, cream or ointment, and antihistamine.
Mm-hmm.
Diaper rash is the next topic. This is very common and everybody knows this.
Mm-hmm.
Also common to adult who are wearing diaper. Okay. Now the other one is prickly heat. This is an itchy skin rash caused by trapped sweat. Okay, when the narrow ducts carrying sweat to the skin surface get clogged, the trapped sweat causes inflammation, which produces irritation, causing itching.
Mm-hmm.
The treatment is appropriate clothing and cool climate. What do you call this? You can wear light clothing also.
Okay.
Lotions containing corticosteroids, creams with menthol for relief, and aluminum chloride solution for heavy sweating.
Prickly heat, doktora, in Tagalog is?
Ay bungang araw. So lahat tayo alam natin yung bungang araw, which
Yeah,
is very common ngayong summer, di ba?
yeah, that's
Kaya
right.
lang papasok na ang tag-ulan, medyo mawawala-wala na siya.
Mosquito bites naman ang papasok, Dok.
Okay. Oo, yeah, mosquito bite naman. Kasi papasok na si dengue.
That's right, yeah.
So another skin disease entity, yung folliculitis. Inflammation of the hair follicles caused by infection with Staphylococcus. Ito yung tinatawag nating
Kulitiw?
no, yung pigsang daga kung tawagin sa Tagalog kasi yung maliliit siya. Oo. Pero common yan sa may buhok. Basta
Yeah.
may buhok.
Ito sa eyelashes.
Oo. Yung iba sa eyelashes. Yung mas malaki naman na yung boil kung tawagin natin, which is large, tender, swollen, and raised area caused by Staphylococcus din. So, for treatment, we keep the skin clean, antibiotics, and antibacterial soap also can be used.
Doktora, pag pigsa po, tama po, the antibiotics are both oral and topical.
Oo, pwede. Pwedeng sabay yon, mas mabilis gumaling.
Okay.
Yung cellulitis naman, ito yung mas malalim na infection na to. It is spread beneath the deep layers of the skin. So it can be caused by streptococcal or staphylococcal bacteria. Treatment talaga is antibiotic. Ito yung tinatawag sa Tagalog na kulebra.
Kulebra.
Kulebra kung tawagin nila sa Tagalog.
So oral antibiotic siya. Yeah.
Yes, alright. So ang scabies naman, ito yung tinatawag nating galis aso, di ba? So it is a mite infestation that produce tiny reddish pimples and severe itching. So ang cause nun yung itch mite. Ang treatment pa rin ay cream with permethrin and solution with lindane.
Or doktora, sulfur soap will also help, di ba po?
Yes, dapat sulfur soap muna ang pangpaligo nila everyday habang andyan pa yung scabies. Pero pag magaling na sila, pwede na silang lumipat sa ibang soap.
Yes.
To maintain. Pero yung mga mild soap na lang.
Mm-hmm.
So for a family to be healthy, must have the following.
Mm-hmm.
Okay, we should have the antifungal, antiviral soap, which is the Neemit, the Ultramed, the mild soap, and then the Pedia S, which is antibacterial and scabicidal soap, and the Norash for diaphragms, and bed sore also you can use for bed sores.
Yeah.
And the IC liquid soap for bathing for babies.
Yeah.
Then the Nobite lotion, well, we need this now because dengue is now on the rise. Mm-hmm. So we have to be ready with our Nobite lotion.
That's right, yeah.
Thank you.
Doktora, salamat po. Napaka-brief and concise nung pinakita nyo. No? Ako, ang na-capture ko dun sa binanggit mo, Doktora, you mentioned about ang reason bakit tayo naka-quarantine lahat is precisely because merong COVID. Kaya dun sa presentation nyo, napansin ko, diniscuss nyo muna yung ano ba yung yung mga manifestations ng COVID. Kasi yun nga sinasabi, kasi in the first place to begin with kaya ka naka-queue kasi may COVID. Pero diniscuss nyo rin dun sa ano yung mga manifestations, sabi nyo may mga additional skin manifestations ngayon ng COVID-19.
Yes,
Tama po ba
dinagdag
na?
ng WHO.
Yan, na binanggit ng WHO na dapat aware din tayo on top of fever,
Cough, throat pain.
and the rest. Meron din tayo nakikita dapat sa skin, yung mga nagkakaroon ng skin manifestations that are manifestations of COVID-19 also. But apart from the COVID-19, binanggit niyo rin, Doktora, meron pa rin naman talagang non-COVID related na skin disorders. Doon po pumapasok yung nabanggit niyo na pigsa, na bungang araw, tama po ba? At saka yung galis aso, tama po ba yun?
Galis aso, kung tawagin mo.
Tapos, Doktora, nung nandyan ako sa clinic mo, nabanggit mo, I think, yung most common skin disorders lately are, what's this one? Pigsa. Oo. Doktora, bakit po ba nagkakapigsa? Naka-quarantine na yung mga tao sa loob, nandun na sa loob, no? Although alam natin ang pigsa could be, it is an infection of the skin talaga that involves, sabi mga staff. Bakit po ba natin nagkakapigsa at paano po ba natin maiiwasan? Because I heard a lot have been having pigsa ngayong naka-quarantine sila. Sa prison nga daw, puro pigsa yung mga prisoners ngayon, Doc.
Yes, kasi di ba mainit ngayong summer, di ba? So, pagka mainit, ang pore ng skin nag-o-open up.
Okay.
So, pagka merong kang kumati sa ulo mo, kakamutin mo with your dirty hands, and then you introduce the infection. So, doon nag-uumpisa ang pigsa. Yung iba namang bata, kung makaiyak at makaano ng mata nila, pag usok ng mata, doon din nag-i-introduce ng infection.
Tapos
kaya,
po,
kailangan lang, yun nga, frequent lang ang pagpapaligo, pero maigsi lang ang pagligo. And then, paggamit ng antibiotic kung kinakailangan na.
Kung kinakailangan. And you also mentioned, Doktora, na sabi mo nga, hindi pwede long-term gamitin yung mga sulfur. So, although ang Pharmaceia Jimenez, yung sponsor po natin today, meron din po tayong sulfur soap pero natural ang kanyang sulfur. So, it's safe to use even by your pediatric patients po. Pero sabi niyo po, babalik kayo after using the sulfur soap, bumabalik kayo sa isang soap na maintenance. Ano po ang ginagamit niyo in handling?
Basta magaling na yung lesions, pwede ka ng from sulfur soap, pwede ka nang lumipat sa Ultrame or sa Neemit. O Neemit also, you can go to Neemit.
Opo. Yung Ultrame natin, that's our soap for sensitive skin. That's glycerin-based po. Kaya very mild lang din po siya. Binanggit niyo rin po yung Neemit, Doktora. Kailan niyo po ginagamit yung Neemit soap?
Neemit soap? Neemit soap, pag ganun din, pag maraming mga sugat ng bata, I use that. Pero yung mga mothers kasi, napansin ko, pagka inintroduce ko ang Neemit, dinidiretso na nila yon kasi nagustuhan nila yung effect.
Nagustuhan.
Pwede naman din.
Pwede rin naman. Ganyan din yung kilala kong doctor, si Doktora Nang, sa practice niya. Yung mga pasyente niyang nagugustuhan yung Neemit, dinedire-diretso na. Hindi na bumabalik dun sa dati niyang soap. So, Doktora, pakinggan naman natin from the consumer side. Unahin natin yung mommy of two, si Mami Maricel. She has actually something to share kung ano nangyari during hanggang ngayon, may quarantine pa, pero yung mga anak nasa bahay. Mami Maricel, kwento mo naman at baka you might want to ask Dr. Pua and she can address your concern.
Yes. Oo, Doc. Kasi yung daughter ko, meron siya sa skin niya parang dry spot na pag i-compare mo siya dun sa katabi niyang skin, hindi naman dry. Pero meron siyang parang patch. Tapos medyo dry siya.
Okay.
Oo. So
ano
ba to? Dermatitis ba yun?
Oh, yes. Pwede kasing yun, pwede din sa pawis niya.
Oo, kasi sa likod eh.
Oo, pwede rin sa pawis niya. Kaya lang kasi dapat, ano ba ang soap na ginagamit niya? Baka mas malakas. Pwede tayo lumipat sa milder soap. Ano ba ang sabon niya ngayon?
Actually, Doktora, yung mild lang naman na soap, yung Setyl Cetaphil na soap.
Okay. So maganda na yung kanyang yung kanyang sabon. So
So,
palagay ko
i-continue lang
kailangan
yun.
continue mo na lang yun, pero kailangan na lang siguro mag-apply ka na lang ng lotion. To make it,
Moisturizer.
moisturizer.
So,
But you choose
eventually,
yung mga
doktora,
white color na mga moisturizer kasi di ba maraming mga kulay-kulay yan. The
Opo.
white one is the mildest.
Unscented naman, doktora. Yung Cetaphil din po, okay rin naman po ba yun?
Okay yun, okay.
Unscented na lotion.
Okay naman yan.
Tapos, doktora,
Pati likod ka mo, meron din, di ba? Pati likod.
Opo, sa likod. Actually, sa likod po siya talaga nag-start. Oo.
Or Mami
Moisturizer.
Or Mami Maricel, if I may suggest with the indulgence to our very good doctor, our Ultrame also is it is
mild.
It is very mild and it does not dry the skin. So, kung meron kang gustong i-alternate dun sa current na brand na ginagamit mo, you might want to consider our Ultrame soap available in Sastal. Mami Maricel, you were saying something.
Yeah, yun naman yung sa daughter ko, yung meron siyang dry sa skin niya. Tapos yung son ko naman, kasi di ba quarantine, so hindi nakakapagpagupit ng buhok. So yung bangs niya tumatama sa mata, tapos siguro kinakamot po. Tapos merong nag-develop na parang bump dun sa eyelid, tapos yung one time dito sa may bandang baba. So, paano yung doktora? Parang stye ba yun? Kulite?
Oo, stye yan. Naka-classify din siya sa boil or folliculitis. Parang
nga yung pinakita yung kanina.
ng mata. Pero kailangan mo dyan mag-antibiotic na. Kasi pag tumagal, baka kailangan pang buksan.
Isi-surgery pa.
Oo. Kaya ngayon pa lang, sana ma-address mo na ng antibiotic. And cut na ang hair.
Oo nga, doktora, nakatali na nga po yung buhok niya.
Photo tayo ni Then, nasaan na. Anyway. Ayun. So, Mamay Maricel, nasagot ba ni doktora yung question mo? Oo.
Yes, thank you, Doc.
Pwede daw i-antibiotic, tama po ba, doktora?
Oh, yes.
Oo. Or pag, doktora, pag it needs already the attention of an ophthalmologist po ba ang gagawa nun? Pag just in case it has to be open?
Pwede mo na sa general pediatrics. Tapos pag hindi talaga nag-heal, then the opta people na.
Oo.
Si Dr. Eric yon, yung anak ni Doktora Rowena. Hi, Dr. Eric. I hope you're listening. So,
layo naman, di ba?
Si Doktora actually has a daughter na dermatology, si Doktora Risa, and she also has a son who's also an ophthalmology. So, pag nagkaroon ng gano'n, needs a surgeon, we already have an ophthalmologist sa
layo lang ni Maricel.
Oo nga po.
Kasi dati Hospital of Infant Jesus si Dr. Eric Kaya nung nagtitraining siya, 'di ba po, doktora? Okay. Yeah, so thank you, Mami Maricel. Balikan kita mamaya.
All right.
Neemit naman from the teenagers kwento si Mr. Luke, or should I call you na lang Luke? Baka magalit sa akin, Luke. Kwentuhan mo naman kami, ano yung mga common challenges ng isang teenager ngayon na nakakulong or hindi pala nakakulong, nasa loob lang ng bahay. Sige, Luke.
Doktora, tanong ko lang po, kasi kami po mga bata, we barely get sun exposure po. And kapag wala po kaming sun exposure, halos wala po kami nakukuha na vitamin D every day. Meron po bang alternatives to get the right amount of vitamin D every day, especially for us kids?
Actually, may bagong dating lang ang vitamin D sa Philippines. Meron na tayong vitamin D. Kung hindi ka ma-expose sa sun, may vitamin D na. May ginagamit na kami vitamin D drops sa babies. Kaya meron din vitamin D na. It comes in capsule. Okay?
Opo. And then, another problem naman po, actually, medyo common din naman po sa friends ko po, is yung pimple and acne breakout po. Parang doon po kami talaga pinaka-conscious. Parang, are there ways to treat them using home remedies, especially in quarantine po?
Oo. Actually, yung pimples kasi, kasalanan niya ng kamay natin eh. We keep on touching our face, di ba? Dapat avoid. And if you want to touch your face, you better get a tissue and then yun ang gamitin pang
I see.
gamot, And then, but number one, is to use a mild soap. Never use antibacterial soap. Kasi if you keep on using your antibacterial soap, you will remove the natural flora of your skin. So you better use a mild soap. And then, that is the number one rule is really cleanliness and avoid touching your face. But if the pimple is already so many, I think you have to see already a dermatologist so that you can remove the inner pustules in your face because it will not get healed. It will just keep on opening. It dries, then it reopen, and then it adds some more. Okay, so while you have those pimples, have it checked right away so that you don't have, it will not scatter into your face. Okay?
I see. Tapos, last na lang po. At home po, paano po kaya matitreat yung acne na cause ng stress?
Stress-related.
Yeah, stress-related. Pag stress-related, you have to learn how to be unstressful. Diba? Kasi there are people who really, they give a problem to a small problem. Dapat talaga you learn how to, you learn how to cope up with the problem because problem has to be solved and not diba?
Pero, maintaining naman po, pwede po bang gamitin yung mild soap in treating these acnes or antibacterial po?
No, you don't use the because when you treat the pimples and you use the antibiotics, you maintain na lang your face with the mild soap.
With the mild soap.
With the mild soap.
So, okay. Clarify ko na lang po last time. Kailan po best ginagamit yung antibacterial soap?
Antibacterial soap, that is very nice, especially in using it in the armpit to prevent the smell. The antibacterial soap, sometimes you can use once or twice in a week. But regularly, you use the mild soap.
The mild soap po for every day. Okay. Thank you po, Doktora. Thank you po.
Okay.
Actually, Doktora, sinagot ni Luke yung tanong niya kung ano daw dapat ang gamitin. Sabi mo, Luke, IC. Di ba, Doktora, may IC rin po tayo. IC.
So, IC is the liquid soap for babies. But for adult, we use the Ultramen, no?
The Ultramen po.
The glycerin-based soap.
Si Luke naman po still falls under the category of a pediatric patient.
Pediatric.
So, pwede pa po siyang mag-IC liquid soap, Luke. Pwede ka pa rin mag-IC liquid soap. Tama po ba, Doktora? That's a very mild antimicrobial liquid preparation that is very ideal for sensitive skin.
Yes.
And is also available in Southstar, Generica, and TGP. So, yun po yung kagandahan nung ating product portfolio. Meron tayong pang different ages that can cater to different requirements ng isang tao. So anyway, Luke, I hope nasagot ni Doktora Pua yung mga concerns mo. Babalikan ka ulit namin mamaya. Meantime, let's try to hear naman kung ano yung mga questions natin na mapipili this afternoon na because it's already past 12. Doctor, thank you for staying with us. Sabi ni Miss Karen Santos, "Hi Doctor, I have 3 daughters of different ages, 14 years old, have sensitive skin, allergy, and dry skin area. I also have an 8-year-old and 5 months. What soap suits for them?" Doktora Pua.
Ang may recommend ko is yung glycerin soap natin, yung Ultramen. Para hindi mag-further ang dryness ng skin.
So since meron siyang 3 different ages, you recommend Ultramay, which is for sensitive skin.
Yes, kasi ano naman pa ang ages nila, halos magkakalapit pa.
Halos magkakalapit naman. Or yun nga, doktora, since sabi mo nga, pwede rin namang combination of either the soap preparation or the liquid preparation. So pwede rin silang, they can also opt to try IC or the IC for infant care liquid. Okay. Yung next question natin, thank you Mami Karen for asking that question. Galing naman kay Miss Jane de los Santos. She's watching from, hi Miss Jane, she's watching from Parañaque, from D.V. Duran. Ano pong soap ang pwedeng gamitin pag oily skin naman? Sabi po niya, kasi po mabilis po siyang magka-pimples, doktora. Oily siya, so mabilis siyang magka-pimples.
Oily skin. Kasi pinanganak siyang oily skin, so prone siyang magkaroon ng pimples talaga. Diba?
Right.
Oo. So, dapat, we can still use the mild soap that we have, the glycerin soap,
Okay.
provided, since oily skin siya, magkakaroon dapat siya ng washing of the face in between. So, pagkapaligo sa morning, if she has time to wash her face at noontime, okay, so to get rid of the excessive oil.
Get rid of the excessive oil.
Oo.
So, doktora, tama po ba? Sabi nyo nga, dahil oily skin siya, ano na yon, genetics na ba talaga yun? So, ang remedyo na lang for her is to wash in between and then at the same time, wash yung for sensitive skin, yung nga nabanggit natin, si Ultramay.
Yes, Ultramay.
Oo, actually ako doktora, I'm also a person who has oily skin, but sabi ko nga I'm wearing a little medyo I'm trying to show or bearing as a part of my skin kasi para makita ko makakonect ako dun sa common skin disorder. Yung oily skin na yan, nabanggit din ni Lu kanina na sabi apparently marami pa ring nagsasuffer regardless of age sa pimples because it's genetics. So are you saying, doktora, na forever or lifetime na natin gagamitin yung sensitive, yung soap for sensitive skin, lalo na kung oily tayo at saka prone tayo to pimples?
Yes. Actually nga, mas maganda yung you stick to one kind of soap, especially sa face. So, especially sa face. Hindi yung papalit-palit kasi doon nagkakaproblema din.
Pagpapalit-palit tayo. Oo. So, doktora, yung kanina na binanggit ni Mami Maricel, yun ba kanina na sinasabi niya na meron siyang eye infection? Pwede pa rin ba natin siya gamitin ng wash na aside from the binention na brand niya kanina, pwede pa rin natin siyang gamitin ng ibang soap preparation? Kasi di ba meron iba talaga, they use soap for washing their face. Pwede pa rin po ba natin gamitan yun?
Yeah. Actually, yung IC liquid soap, you can use that in washing your eyelashes.
Okay.
Ina-advise namin yung wash the eyelashes.
Alright.
To avoid yung parang mga stye.
Stye, oo.
Tapos, yun ang ina-advise din ng Opta.
Ng Opta. Nandiyan si Dr. Eric, I'm sure he will agree with us. And nandiyan din si Dr. Risa Aderma. Last question, Doktora, from our FB Live viewer. Magtatanong lang siya. Ang sabi niya, coming from Mami Malen po siya. Sabi po niya, hello Dr. Pua. Ano po ang recommended na soap po kung oily skin at palagi pa rin pong wash ng face dahil may tendency na ba dry ang skin po ba? Siguro po ang tanong ni Mami Malen, oily skin pero laging nag-wash kasi sinabi niyo, binanggit niyo kanina, every merong in-between washing, I think, Doktora, tama po ba ako? Ang nagiging problema rin sa oily skin, dahil oily ka, wash ka ng wash. Tama po ba? Tapos nag-dry ulit. So ano daw po ba ang sagot doon kung gano'n?
Hindi, kasi kapag naman sumobra ka naman ng kaka-wash your face, lalong magda-dry ang skin. Kaya ang sabi ko lang, when we take a bath in the morning, then have a face wash at noontime, and then the next bath is already at night. Pero yung halimbawa, during daytime, nakakailang ka ng wash ng face, lalong magdadry ang skin.
Okay. Kasi doktora, parang Yung iba po kasi every time that they will go out of the house, like if they're gonna get something lang sa tindahan, pagbalik, dahil nga po sinasabi nila, do not underestimate the disease. Ang
Sa COVID.
nangyayari, laging ligo ng ligo. Kada lumabas,
Okay.
pagbalik ng bahay, ligo na naman.
Ligo na naman.
Clothes,
Oo.
wash, gano'n, no, doktora? Parang ganun po ata ang case ni Mami Malen. Kada lumalabas sila ni Daddy Dennis, pag uwi po ng bahay,
Ligo ulit.
naliligo, nagpapalit ng damit. Kasi may laundry, ano yan, business yan, kaya kaya niya magpalit ng damit. So yun, Mami Malen, nasagot ka ni Doktora Pua, sabi niya, you try pa rin po, Doktora, yung sensitive, ano, at saka kung sensitive soap, for sensitive skin na soap, at the same time, morning and evening lang po ang paligo. Oo, kaya ang mahal na ng tubig natin sa dami ng paligo. Opo. Isa na lang po, Doktora, humabol si Jefferson de los Santos. Sabi niya, ang sipag ng ating mga viewers na mga de los Santos. Nasaan kayo mga de los Santos? Salamat sa inyong pagtanong. Doktora, kaming magpipinsan po kasi dahil quarantine, panay gadgets and playing games po kami online and late kaming natutulog. Daming acne ko po at nagsasuffer din po ako hanggang sa likod. Nakakahawa po ba yun, Doktora?
Yes, nakakahawa yan.
Ay, talaga?
Pag tinanganan mo yung likod mo and itinangan mo din sa kabilang ibang skin, lilipat yun.
Ang acne.
So, na rin. Shorten na yung laro ng gadget. Kasi, di ba, pag masyadong kulang ka sa tulog, pangit din ang effect nun sa ating balat, di ba? So, kailangan itama din yung tamang oras ng tulog.
Ayun. So, hindi lang ang sagot soap at ligo. Kasama rin sa sagot yung tamang pagtulog, tamang oras ng pagtulog. At nakita ko rin po dito sa isang nag-comment, what about daw po yung pagkain? Mukhang ang napunta tayo, Doktora, sa acne na issue, ano?
Acne
Paano daw po ba yung sa nutrition naman, yung pagkain niya? Does it have a direct effect dun sa pagpipimples nung inyong pasyente o nung nagtatanong? Kasi kung sabi nyo nga may effect yung pagtulog, tapos natatransfer mo rin to sa kabilang, sa ibang katawan. What about po yung issue naman dun sa pagdating sa nutrition? Does it have any direct effect dun sa ating acne or sa pimples nung nagsasabi?
Dapat sa nutrition, tama yung atin, we have to have a balanced diet. But to avoid naman fatty foods at saka yung mga chocolates.
Chocolate, sugar.
Number one is the chocolate that causes the pimple. Kaya,
peanuts, Doktora.
Yeah, peanuts, chocolates, basta may fats talaga, 'di ba? Lahat naman ng nuts may fats, 'di ba?
Oh.
Moderate lang. Pag sinabi lang moderate, katulad sa mga nuts, dapat mga minimum of 20 pieces lang in a day. Pwede na 'yon. Hindi naman isang supot in a day.
May alam ako, Doktora, kung kumain isang can of nuts. Pero hindi nagpipimples, hindi nagrarayuma kasi Iron Man siya. O, di ba? Oo. Kaya kahit anong kain niya ng nuts, isang can ng nuts, hindi nagpipimples.
Talaga.
Dinadaan niya sa Iron Man.
Actually, meron din talagang prone mag-pimples eh. Meron namang hindi talaga prone din mag-pimples. Ewan ko ba? Swerte mo pag hindi ka prone mag-pimples.
Oo nga, Doktora. Ako kasi dati mag-pimples ako, kaya lang, dahil nag-IC ako at saka nag-ultrame ako, Doktora. Hindi na ako nag-pimples. Pag walang IC, Setyl active. Pwede rin yun, Doktora. Yun ang kagandahan ng mga produkto ng Pharmaceia Jimenez.
Yes.
Panghugas, pwede na gamitin. So, Doktora, I think that's our last question. Meron pa daw pong isang humabol. Last na lang, Doktora.
Okay,
Doktora, salamat. We are so really privileged and blessed to have you, and we are already on overtime, and yet you're still sharing your very precious time with us.
Okay.
Last na lang daw talaga. Sabi ni, I hope I'm mentioning your name right, Jeffer Blasa Daduyo. Doc, ask ko lang po kung okay lang gumamit ng mild soap for acne habang umiinom din po ng gamot for acne. Salamat po. Napunta
Oh
tayo
yes,
sa acne. Yan.
magkatulong dapat talaga yan. O,
Okay.
habang umiinom ka ng antibiotic mo, then naka mild soap ka pa rin, yung glycerin soap natin.
Okay. So
Changes na yun.
sabay yung pag-inom ng gamot, doktora, tama po ba? And at the
Oo.
same time, gumagamit ka pa rin ng glycerin-based
Base soap.
na soap
Yung
na
Ultramen natin.
Opo. So I guess, doktora, na-cover natin ngayon a lot of skin disorders, pero mostly ang nagiging issue natin I think is acne. Although sabi nyo nga, nabanggit nyo rin kanina, papasok na ang tag-ulan. So yung mga siguro acne na yan, mababawasan naman during rainy season. Ang
Papalit na ang dengue.
Yes.
Papalit na ang dengue, kaya yung ating Nobite lotion ay dapat meron tayo nun.
Agree, doktora. Yung Nobite lotion, available naman din yan kay Southstar, Generica, TGP at Mercury. Kaya tamang-tama po, bago dumating si dengue, mag-stock na po tayo sa bahay natin. Pero doktora, ayaw tumingin ng live viewers natin. Talagang isang isa na lang daw.
Okay lang.
Nagmamakaawa siya kasi sabi niya, you have a very good doctor with you there. Might as well ask. Sabi ni Oris Nina Eda Domingo. Hi Doc, last question naman po please. Pwede po bang gumamit ang 11 years old ng skincare dahil sa acne? So apparently may acne siya, pwede po ba daw gumamit ng skincare?
Yes, oo.
11
Dapat
years
talaga.
old po, doktora, ha? 11 years old.
11-year-old.
Pwede
Kasi,
po.
since very mild yung ating glycerin soap, pwede nga siya from babies up to teenager.
Okay.
Kaya pwede niyang gamitin yon.
Pwede pa rin. Basta I think
pa rin.
if I'm getting it right, doktora, what you're trying to say, basta glycerin-based na soap, from 0 onwards, pwede nilang gamitin.
Can be used.
Yeah. It is so much better without the perfume, without the color. Diba, doktora?
Yes.
So
Pagka mga teenager na sila, pwede nilang gamitin, halimbawa, still using the mild soap, pwede nilang isingit yung antibacterial soap twice a week. Para bang nagje-general cleaning ka din. Ganon. Di ba? Tapos everyday mild soap and then twice a week you use the antibacterial soap. Ganon. Not every day for the antibacterial.
So not every day the antibacterial, pero the mild soap or the soap for sensitive skin pwedeng gamitin
Can be every day, yes.
Buti na lang ang sponsor natin, doktora, very wide ang variety ng soap. Kasi meron din siyang antibacterial, antiviral, antifungal soap, which is our Neemit. Salamat, Neemit. Okay. In fact, doktora, yung Neemit, Neemit Clean Isopropyl Alcohol, yun ang katerno ni Neem soap, ni Neemit soap. So, para hindi lagi silang hugas ng hugas, meron tayong Neemit Isopropyl Alcohol also. Doktora, nabigyan kita noon, di ba?
Yes.
Bigyan kita.
The new brand. Okay.
The new brand, opo, Neemit. Okay, so doktora, I think that will be our last question for this episode. Maraming salamat po. Isa kayong napakalaking tulong sa amin sa pag-guest nyo dahil alam ko pag Sabado very busy ang mga pediatrician sa bakuna at sa mga batang nagbibisita on a Saturday. Salamat po for your time. Bago po tayo magpaalam, pwede po ba kayong mag-iwan ng inyong mensahe sa lahat ng nakikinig at pakibanggit din po kung saan po kayo pwedeng puntahan doon sa mga nabitin nating live viewers. Kung saan po kayo pwedeng puntahan.
Okay, napakalayo. Nasa Los Baños to. Nasa Los Baños lang na ako.
Doktora, remember ang mga nakikinig sa ating doctors are PPS Southern Tagalog. Mentioning ko lang, Doktora Aleli de Mata, salamat. Doktora Benzi Manalo, salamat. Doktora Marivinang, salamat. Dr. Speedy Bagal, salamat. Dr. Clea, salamat po. Maraming doctors ang followers ni Doktora Pua, salamat po. Yes, Doktora.
Okay. Well, kung malapit sa Los Baños, ang aking clinic ay nasa Los Baños Doctors Hospital, Monday to Saturday in the morning. And then afternoon is Calamba Medical Center in St. John.
and St. John. Salamat po, Doktora, for that. And any message po sa mga nakikinig sa atin dahil ilang months na po tayong naka-quarantine. Ano po bang pwede niyong iwanan sa kanilang message while they are on queue pa din?
Okay. Ang sabi nila ngayong may quarantine, madaming nadidepress. Wag na tayong gumaya sa kanila. Gawin na lang nating ang pagka-quarantine natin ay blessing kay Lord.
Yes. Yeah.
Okay? Kasi nagkakaroon tayo ng time for family bonding.
Family bonding. That's right. Oo. Ako, Doktora, favorite ko yung this is not just a time of survival but a time of revival ng maraming magagandang bagay na pwede nating i-revive.
Ang sabi nga nila, business for 2020 is not possible. But the main thing you should aim is to be alive.
Yes, agree. 100%. Doktora.
To be alive.
To be alive. Salamat po. Doktora, may humabol pa. Isa na lang daw. Ayaw paawat nakikiusap. Naglulumuhod yung sa text niya.
Okay.
Is it good for atopic dermatitis? And the baby? Yung yung soap that you are trying to mention?
Oh, yes. The Ultrame, that is the mildest soap. And very mild, very gentle.
So, okay siya for babies and atopic dermatitis.
Pwede na rin yung gamitin shampoo ng baby from head to toe.
Yeah. Nako, talaga naman, Doktora, you are such a wonderful guest for us dahil napakagaling mong sumagot ng tanong ng FB Live viewers. Salamat po, Doktora. At nangako yung aming big boss na bibisitahin kayo dyan. So, abangan. Opo.
Okay.
Salamat po, Doktora. At gusto rin po nating magpasalamat doon sa ating dalawang consumer viewers from the consumer side. Mami Maricel, thank you.
Yes.
Can we hear something from Mami Maricel?
Yeah.
Thank you, Doktora. Very helpful po yung advice ninyo.
Okay.
And si Luke, are you still? Can you say goodbye? Can you say something before we go, Luke?
Doktora, thank you po ulit for entertaining our questions.
Okay.
Thank you so much po.
Si Luke, pinayagan ng Mami Malen at Daddy Dennis niya. Salamat po mga Mami and Daddy Malen. Mami Malen and Daddy Dennis. Remember, glowing skin is always in. Ang sabi nga, always put your smile on your face. That's the prettiest thing you can wear all this time during this crisis. So, ang next episode po natin, next Saturday po, Doktora, sandali lang po, i-mention ko lang po para dun sa ating laging mga nanonood. We will have an episode again on how to maintain an active life during this time of quarantine. This is going to be next Saturday again after a week. Please do stay with us again next week. Hintayin niyo po kami and we will definitely have another very interesting topic with regards to quarantine. So maraming salamat po. Be safe, keep safe, and God bless po everyone. Magandang tanghali po.
Thank you.